Vanakkam. My name is Dr. Krishnarathinam. I am a hematologist and oncologist. I am in this field for the last nearly 25 to 30 years, and I have been managing mainly diseases of the blood forming cells and cancer related to the blood. And I also am an expert in the field of bone marrow transplantation. I will explain to you what is that. Recently, we have initiated doing bone marrow transplantation in this hospital, CBS hospital. We have done about 3 cases successfully. Actually, the concept is some of the cancers related to the blood forming cells can be cured by conventional doses of chemotherapy, but some of the cases will require very high dose of chemotherapy, especially when they relapse. The idea of giving high dose chemotherapy is to avoid the disease getting into relapse again. So what we do is we give very high dose of chemotherapy. But the problem with giving high dose of chemotherapy is the normal blood cells also will get destroyed. And the normal cells will get destroyed, the patient will not recover. So there is an idea to circumvent that. What we do is we collect the blood forming cells even before giving the high dose chemotherapy. There are some procedures to do that with a machine, with the help of a machine called cell separator or a 𝗕றிસિஸ் machine. It's called as 𝗕றிસિஸ் machine, which we have. It is done by the blood bank physician. We collect the stem cells and we sometimes store it so that the cells will be lying outside the body. That can be used to rescue the patient. So once that is done, we calculate the number of cells and then that is kept aside. Then we give the high dose chemotherapy to the patient. After the high dose chemotherapy, we reinfuse the stem cells or the cells which are collected, which are the blood forming cells, otherwise called as stem cells. So those stem cells which are infused will go and multiply, and the patient will regain normal blood production. And the high dose chemotherapy which you are given already will kill the tumor cells or the blood cancer cells, which will supposed to grow and kill the patient. So we don't want to have that. So the cancer cells will be killed by the high dose chemotherapy, but the normal cells will be rescued by the cells which are already collected outside and kept stored outside. So this is a process which is very simple. This is called as autologous transplant, where the patient's own cells are collected. There is also another procedure where a different donor can be used. That is called allogenic transplant, which also will be done soon in certain cases, especially in acute blood cancer or acute leukemias. So we have done for about 3 patients, 2 patients with a disease called multiple myeloma, which is a disease involving the blood forming cells, and some of the patients have relapsed with the routine chemotherapy. So we have to salvage them with the high dose therapy, and both are doing well. The other patient is a patient with a lymphoma, that is the cancer involving the lymph node, and that particular patient relapsed after the standard chemotherapy, and then we had to salvage him with high dose therapy with this autologous stem cell rescue, or otherwise we call it as bone marrow transplantation or autologous transplantation. So fortunately all the 3 patients are doing well, and we hope that they will do well in the long term also, and we hope that this procedure will go uneventfully in the coming years. So thank you very much for the listening.
VS Hospitals, care, cure and compassion.